In this video, we're going to share with you some eye-opening information about sugar that is going to change the way you eat for the rest of your life. If you're like most people, you probably think sugar is harmless. Well, I'm here to tell you that's not true. Sugar is actually one of the most dangerous things you can put in your body, and today I'm going to share with you why. Please subscribe today for more naturally healthy, and let's get into this sticky sugar problem. Red blood cells are used to determine the level of blood sugar in humans. The level of sugar in your blood is determined by the amount of glucose in your red blood cells. Glucose is a sugar that is found in many foods and is also produced by the liver. When you eat food, the glucose from the food enters your bloodstream and is taken up by your red blood cells. The level of glucose in your blood can be measured by a simple blood test. If you have too much sugar in your blood, it can damage your arteries and lead to heart disease, stroke, and other serious health problems. That's why it's important to keep your blood sugar at a healthy level. You can do this by eating a healthy diet and getting regular exercise. You should also talk to your doctor if you have any concerns about your blood sugar. What happens to your red blood cells when you eat too much sugar? If you eat too much sugar, the glucose from the sugar will enter your bloodstream and cause your blood sugar level to rise. This can damage your arteries and lead to other serious health problems. That's why it's important to keep your blood sugar at a healthy level. What is glycation and how does it impact the function of your red blood cells? Glycation is a process that occurs when sugar molecules attach to proteins in your body. This can damage the proteins and make them less effective. Glycation also impacts the function of your red blood cells. Red blood cells are responsible for carrying oxygen to all the tissues in your body. When they are damaged by glycation, they are not able to carry oxygen as effectively. Glycation is thought to play a role in the development of diabetes and other chronic diseases. Glucose can cause red blood cells to become stiff and misshapen. This damages the red blood cells and makes them less effective at carrying oxygen. It also causes the red blood cells to have a hard time going through the smaller blood vessels in the extremities of your body like your fingers and toes. That's why it's important to keep your blood sugar at a healthy level. You can do this by eating a healthy diet and getting regular exercise. What is hemoglobin? Hemoglobin is the protein in red blood cells that carries oxygen. HbA1c is formed when glucose binds to hemoglobin. The more glucose in the blood, the more HbA1c is formed. What happens when the protein part of the red blood cell called hemoglobin is exposed to sugar? When hemoglobin is exposed to sugar, it can become damaged. This damages the red blood cells and makes them less effective at carrying oxygen. This can lead to fatigue and other problems. What is an A1C test and how does it relate to the level of sugar in your blood? An A1C test is a blood test that measures the level of glucose in your red blood cells. The A1C test is a good way to measure your average blood sugar level over the past 2 to 3 months. It can help you and your doctor see how well your blood sugar is controlled. If left unchecked, too much blood sugar can lead to prediabetes or diabetes. How is prediabetes determined? Prediabetes is determined by a blood test called the A1C test. This test measures the level of glucose in your red blood cells. If your A1C is between 5.7 and 6.4%, it means you have prediabetes. This means that your blood sugar is higher than normal, but not high enough to be considered diabetes. If you have prediabetes, it is important to make lifestyle changes to prevent diabetes. These changes include eating a healthy diet, getting regular exercise, and losing weight. You should also talk to your doctor about your risk for diabetes. What is the difference between type 1 and type 2 diabetes? Type 1 diabetes is an autoimmune disease in which the body does not produce insulin. Type 2 diabetes is a chronic condition that occurs when the body does not produce enough insulin or the cells do not respond properly to insulin. What are some symptoms of type 1 diabetes? Some symptoms of type 1 diabetes include increased thirst, increased urination, weight loss, fatigue, and blurred vision. What are some symptoms of type 2 diabetes? Some symptoms of type 2 diabetes include increased thirst, increased urination, weight loss, fatigue, blurred vision, and slow healing wounds. What are some complications of diabetes? Some complications of diabetes include heart disease, stroke, kidney disease, nerve damage, and foot problems. Diabetes can also lead to blindness. What happens to the fingers and toes of diabetic patients? Diabetic patients can develop a condition called peripheral neuropathy, which is damage to the nerves. This can cause numbness, tingling, and pain in the fingers and toes. Peripheral neuropathy can also lead to infections, ulcers, and amputations. How can diabetic patients keep their feet healthy? Diabetic patients can help keep their feet healthy by taking care of their skin, wearing comfortable shoes, and checking their feet every day. They should also see a podiatrist, which is a foot doctor, at least once a year. When does a diabetic patient require amputation? Diabetic patients may require amputation if they develop a condition called peripheral neuropathy. In peripheral neuropathy, there is damage to the nerves, which can cause numbness, tingling, and pain in the fingers and toes. Peripheral neuropathy can also lead to infections, ulcers, and amputations. Make sure to keep watching to the end to see the bonus list of sugars that are easy to avoid. Why does the lack of oxygen in the blood cause infection? The lack of oxygen in the blood can cause infection because it damages the red blood cells. Red blood cells are responsible for carrying oxygen to all the tissues in your body. When they are damaged by glycation, they are not able to carry oxygen as effectively. This can lead to fatigue and other problems. Keeping a healthy diet and staying away from too much sugar is key to having healthy red blood cells, which in turn keeps the rest of your body healthy. Avoiding serious illnesses like diabetes is a major reason to rethink your next dose of sugar or high carbohydrate food. What are carbohydrates? Carbohydrates are a type of macronutrient that the body uses for energy. The body breaks down carbohydrates into glucose, which is then used for energy. Carbohydrates are found in foods like bread, pasta, rice, potatoes, and sweets. What happens to carbohydrates when they are not used for energy? If carbohydrates are not used for energy, they are stored in the liver and muscles as glycogen. Glycogen is a storage form of glucose. When the body needs energy, it breaks down glycogen into glucose and uses it for energy. When the body has too much glycogen that it cannot use, it is stored as fat. These fat storages can cause problems such as obesity and heart disease, just to name a couple. Increased weight on the body from fat storage can also cause knee and back problems like arthritis. How can a person get rid of the fat storage? You can get rid of the fat storage by exercising and eating a healthy diet. Exercising helps to burn off the excess glycogen that has been stored as fat. Eating a healthy diet helps to keep the body from storing too much glycogen. What kinds of foods contain high carbohydrates? Bread, pasta, rice, potatoes, and sweets are all high in carbohydrates. What is the difference between simple and complex carbohydrates? Simple carbohydrates are made up of 1 or 2 sugar molecules. Complex carbohydrates are made up of 3 or more sugar molecules. Simple carbohydrates are found in foods like candy, syrup, and table sugar. Complex carbohydrates are found in foods like bread, pasta, rice, and beans. What is the difference between starches and fiber? Starches are a type of complex carbohydrate. They are made up of long chains of glucose molecules. Fiber is also a type of complex carbohydrate. However, fiber cannot be broken down by the body and passes through the digestive system unchanged. Starches are found in foods like bread, pasta, rice, and potatoes. Fiber is found in fruits, vegetables, and whole grains. Going back to sweets and sugar, what are some easy treats to avoid in order to control sugar intake? There are many types of sweets, candies, and desserts and drinks you can cut out from your diet that will help control your blood sugar levels immediately. Here's a quick list: soda, candy, chocolate, cookies, ice cream, fruit juices, alcoholic beverages. These are all high in sugar and should be limited or avoided if you have diabetes. Eating too much sugar can cause your blood sugar levels to spike. If you have diabetes, it's important to control your blood sugar levels to prevent serious health complications. But what about natural sugars? Aren't they okay? What is the difference between dietary sugar and natural sugar? Dietary sugar is a type of simple carbohydrate that is added to food during processing. Natural sugar is a type of simple carbohydrate that is found naturally in food. Dietary sugar is found in candy, syrup, and table sugar. Natural sugar is found in fruits, vegetables, and milk. Fruits contain fructose, a type of sugar that is metabolized differently than other types of sugars. The body breaks down fructose into glucose, which is then used for energy. Fructose does not raise blood sugar levels as quickly as other sugars. Talk to your doctor about how you can change your sugar intake and keep your body healthy. Avoiding too much sugar will help keep you on the road to good health and happiness. For more naturally healthy, subscribe today and don't forget to check out this video on eating the fat to lose the weight. Thanks for watching.